All right, we're recording.
Awesome. Well, good morning, everybody. I'm Dr. Brady Wyrick. I'm thrilled to be joined with Dr. Kelly Halderman. So, Kelly, welcome.
Thank you.
Looking forward to having a discussion today about the landscape of regenerative medicine, where we are now, and what the possibilities are. The more I read about this stuff, the more I understand, the more I realize that we are on one of the very most important discoveries in medicine. And stem cells are one of the most heavily researched cells inside the human body. And before we started recording, Dr. Kelly and I were talking about we could take this into a really deep discussion and really dive into the science behind this and how these things actually work. But I think for our purposes here, I think it's going to be best if we just kind of keep things simple. What are we using them for? Why are they making effect? How long is it lasting? What are we seeing? I think those are the clinical applications that we should talk about.
Absolutely.
So, I don't know about your clinic. First off, tell me a little about yourself. Tell me your background. Where are you at, et cetera.
Sure. So I think what's important is to realize that I myself not just understand chronic disease from a book perspective, but that I was diagnosed with MS back in 2010 when I was in the throes of practicing family practice medicine. So I am a medical doctor by training, trained at the University of Minnesota, was really was in the trenches, in the, first line of defense, practicing that medicine that really failed me. And that's how I got into regenerative medicine, is that when I got diagnosed with MS, I wasn't even 30 yet. And I was given a box full of pills and a cane because I was having foot drop and all these neurological crazy symptoms. And I was told to go home and be with my family. And it was like a death sentence, Brady. And it was unacceptable to me. So that's when I had to take a step back and I started to learn about regenerative medicine and all that it has to offer. And the main thing that really drives me a little bit insane is that on average, we wait 17 years to implement in clinical research into practice in the field. And people are dying. And if without regenerative medicine, without the things that I started to do myself as I stepped away from family practice medicine, I'd be dead. I know I'd be dead. And so I think it's so empowering that you are bringing this information to people. You are really shouting from the rooftops the clinical science, the clinical data behind what stem cells can do. I myself have actually had stem cells, and we can talk a little bit about that. But I'm currently practiced in the Twin Cities, and we do use a ton of regenerative therapies, and one of them is stem cells.
Awesome. I want to get into some of the other systemic applications and how we're affecting things like autoimmune disease, MS, and some of those crazy, diseases that you've never heard of before, which I still, to this, I've been in practice for 14 years and I still get people asking me about things that I've never heard of. But let's just start at the very surface of this and let's just discuss osteoarthritic applications.
Sure.
The bulk of the people that we do injections for, and I don't know if this is true for your practice or not, but the bulk of the ones that we do are for the synovial joints, the big juicy, I call them the big juicy joints. Shoulders, hips, knees, elbows, we do those all day long. And clinically, that's where they have the most, what's the word that I'm looking for?
Potency, effectiveness.
Both effectiveness and potency are both great words. Statistically, 27 million people have osteoarthritis in the United States. 27 million. So right now, those 27 million people, and that number increases as we get fatter and as we get older. Period. Okay, so right now that number is increasing. But those people, what options do they have when they're told they have osteoarthritis? It's a lot like what you've experienced. Here's your box of pills. Here's a cane. Go home and learn how to deal with this. When it gets to the point where you can't walk or you can't sleep, then we're going to go in and replace the joint. And oh, by the way, after that joint's replaced, you still have a box of pills. Right. So that's where we're at right now. Perfect. 17 years behind where clinical research is. Do you know why Europe kills us on this stuff? It's because they're not 17 years behind. So
Right.
when a patient comes to me with an osteoarthritic joint, I will tell them, here's the basic 3 things that stem cells do. Okay, number 1, they're anti-inflammatory. Okay, so we have people that actually see result within the first couple of days of getting an injection because of the anti-inflammatory effect.
Yeah, we just went over to Sri Lanka. Sorry to interrupt you, but that is like so cool. That's one of the best things is that, we'll have these patients and they'll have arthritis and they'll be in all this pain. And we suggest that they go off, if they can, their anti-inflammatories before the injection. And we will literally see on the table, I was just over in Sri Lanka and I was instructing doctors over there, some orthopedic surgeons. And we had a gentleman on the table, just the knees were shot, rugby player. Almost immediately after injection, he just could not believe the relief. So sorry, I just wanted to note that we see that all the time. It's incredible.
Clinically, we're seeing that more and more when we add PRP to the stem cell injection, which is just, it blows my mind that, something that simple, just taking your own blood, spinning it down, taking that plasma, the power that has, like we're seeing before. I still tell people this to this day. I tell them 6 to 8 weeks to see results, but that's just because I want to have them
deliver. Under promise, over deliver.
But what we're seeing is more and more people that are seeing results within the weekend, which is mind blowing to me. But the other 2 things that those cells will do is, number 1, they help modulate and control your immune system, and then number 3, they actually help to regenerate, regrow new cartilage. So for me, I tell people, and I show them the studies, that yes, these, even with a bone-on-bone joint, they still can grow new cartilage.
Pretty fantastic.
It's, yeah, I look forward to the day, Kelly.
I paused it. No problem. Technology. It's Monday too. So you were saying you look forward to and then we lost you. So
I thought it was my internet connection here because it's been pretty shaky of late. No, I look forward to the day that regenerative medicine is a requirement before someone will actually get a joint replacement, or before Medicare and insurances will pay for a joint replacement. If they had any sense whatsoever, that's what they would do now. But again, we're 17 years behind.
That's right.
So that's the osteoarthritic application. To me, it's a no-brainer. I would hands down do this I would do this before I would ever consider joint replacement therapy. What other applications are you seeing?
So I think it's interesting if you go back and look at what the father of stem cells, Arnold Kaplan, says about the stem cell. And the stem cell we're talking about is the MSC, the mesenchymal stem cells. So MSC, Dr. Kaplan says that he wished it would have been called the medicinal signaling cell, because the important functions of the MSC, the stem cell, it's like in its ability to be a secretome. So like, what is it secreting from the cell? We talked about the regenerative purposes of it and how the cells themselves are anti-inflammatory, anti-fibrotic, they're immunomodulatory, and they're regenerative. So, I mean, think about the wide applications that walks into our clinic and needs help. Now, in my own situation, this is where I'm going beyond the joint, is that my immune system was just on fire. I mean, the MS diagnosis was really just because I had Lyme disease, which I was diagnosed, but my immune system was needing some modulation. And so I actually chose to get IV stem cells about 9 months ago. And I immediately noticed some subjective things. Since I had Lyme, I had some mast cell component, and I really, the vibration of going out and like exercising in the cold weather would set off this cascade where I just want to scratch, like just the histamine, I want to just scratch my skin off and I couldn't breathe. Well, after I got the stem cell, I noticed I was outside and I started to run about 3 weeks later, and I had the symptoms were gone. And then
Mhm.
I also, because I am a numbers person, I'm like a skeptic at heart.
Mhm.
I like anecdotes, but I was trained as a medical doctor. Anecdotes, that means like stories people tell. They really don't mean much when you're looking at trying to put the clinical data and things behind it. So I did some objective markers myself, and I saw that my natural killer cells, the counts went up, and a few other things that I noticed as a doctor really leveled out for me. So, we're looking at, I mean, there's so many, as you know, there's so many clinical trials going on
Mhm.
for stem cells, MS. There's a bunch, and I have a graphic here where I was just looking at the other day, and I was like, wow, there's so many trials going on. And again, I have people walking in my office, and they've run out of options for, let's say, Alzheimer's. They've
Mhm.
run out of options for Parkinson's. So, what are you going to do? Turn those people away? Or are you going to say, here's some data that, that there's clinical trials going on. So we really, we use the stem cells for that immunomodulatory effect
Mhm.
on, patients who we think that there is that component is part of their disease process.
Right. And it's important to note too, like, yeah, we've run out of options for those diseases, but we've with stem cell therapy, we're really just not seeing side effects. Which,
Right. I joke,
you
I'm like, there are some side effects. You may feel better. You may not need your drugs anymore.
know, there are negative side effects.
Yeah. All right. And then negative side
And
effects,
what
right?
I tell people too is like, look, here's the side effect. Here's the absolute worst possible outcome. It may not work
Nothing. Yep.
because there's that small percentage of people. And when I first started this, I've been in this industry now a little over a year and a half. And when I first started, I did an IV myself. I didn't really feel anything. Now I look back and try to figure out why. Number one, I'm a pretty healthy dude to begin with, but number two, I didn't do enough because I'm 6 feet, 200 pounds. One little cc vial of stem cells just wasn't enough. But that's not to say that it's completely changed the life of people right within my own family. For my dad, for example, he'll never have to have a joint replacement now for his knees, which he was scheduled to do both, and now he's off and hiking and biking and being otherwise crazy. But those systemic issues, they're really interesting to me. I had one the other day that reached out to me because she had chronic vomiting syndrome.
Hmm.
You've heard of it? I
Yeah. It's
hadn't.
really, really rare.
Right. So, I mean, this girl would go, she would go 9 days or excuse me, she would go days with 9-hour episodes of vomiting, like
Oh,
uncontrolled, couldn't
that's
stop.
horrific.
And I was talking to her just about her just life in general. It's like she was really grateful that she had a very understanding boss and she could just go home when she needed to. And I can't even imagine. But she came to one of our seminars that we did, and then about 6 months later, which was now, she calls and she says, "I want to do this." And I sat down with her. I said, "Look, the reality, we know what this IV can do," which we actually used exosomes with her, which we'll cover exosomes at another time. Um, I explained to her what the IV could do, but I said, "Here's the reality. We really don't know what's going to happen. This could be absolutely nothing." Well, for her, it absolutely, like, I had a conversation with her last week, 9 days. She was thrilled about having 9 days with no nausea at all.
Wow.
Yeah, pretty awesome stuff.
That is awesome.
So where we're headed next is actually into the aesthetics world, because we know the effects that stem cells and exosomes can have on collagen.
Hmm.
So microneedling, skin toning, getting back some of that elastin in the skin. That's going to be a very exciting thing for us. I'm looking forward to seeing that.
Yeah,
That's what.
I've actually dabbled in that myself. So I've had a couple of stem cell um, facials, and the results that we're getting are absolutely phenomenal. I mean, it just takes time off the clock, ladies and gentlemen. So if you're looking for the anti-aging, it's almost too good to be true. I mean,
Right,
you do.
right.
I mean, you look at the power of these cells, and and it doesn't surprise me, especially with the collagen regeneration and all the things you're saying, discoloration, wrinkles.
Mhm.
It's just really, really natural approach. But I think maybe we should take a step back and talk about the difference between the types of stem cells, so
Sure.
autologous,
Yeah.
allogenic, xenograft. So my patients come in and some of them are wondering because they've heard like, oh, the Mayo Clinic will do stem cells, but
Right.
um, they're using autologous. So those are stem cells from our own body, such as our fat or our bone marrow. Um, they're just quite frankly, they're old. They're as old as we are. And,
Right.
definitely when I'm looking at stem cells, I want something that's young and vibrant. And
Right.
I'm not saying that they don't work, but when you have the choice to go with an allograft, which is from another human being, and that's typically from a healthy mom, healthy baby, from the placenta that was going to be thrown in the hazardous waste anyway.
Right.
And those are considered adult stem cells too, and they are not embryonic stem cells.
Right.
Repeat, those are not embryonic. So people come in
No
and they're like,
aborted fetal tissue, none of that
"That's
crap.
that's right. No, absolutely not. I would not be behind that at all." So nothing.
Well,
No
no, you
one was
wouldn't
hurt.
because you'd be in jail.
Yeah, exactly. I'd be in jail, and I might, if I injected those, you worry that a teratoma would happen. So
Right.
there's so many reasons why we embryonic is not in the wheelhouse of what we do, and it's just nice to mention that because some people still,
Right.
think about that. So the allografts are again healthy mom, healthy baby. You're getting those that cord blood. You're harnessing the cells out of it, and those are brand new. And that's what, and then the exosomes, we can again talk about that a little bit later in different podcasts, but that's what I had injected was the allograft. And
Yes.
my son as well, who has had some head injuries, some TBIs, he's 12. He actually had stem cells IV as well, and he is doing phenomenally
That's awesome.
better. Hmm.
That's fantastic. Well, I think there's so many more topics that we could take off with from here, but I think for an opener, that's a great place to start.
Totally. And then I would just say one more thing is that, there are natural things that can help us boost up our own stem cells. And I'll
Right.
use those in the patient population for anti-aging. And then there's the post stem cell and Dr. Wyrick and I actually are formulating a stem cell formulation. It has lots of astragalus in it, resveratrol, quercetin, horny goatweed, holy basil, CoQ10, things that really help. If you get a stem cell
Right.
injection, exosomes, it's going to help,
The
the
proliferation.
inflammation. Yeah. And then if you're not, I'm still putting patients on that. So stay tuned for that. It's going to be awesome.
You mentioned the mast cell reaction. I don't really want to get too veered off here, but I think it'd be okay to put a shameless plug in for US Enzymes. Uh, Tell me about the product that you've been using for mast cell. There it is.
I just have it right here. So Sun Balance. I formulated this for neural inflammation. It really is good at quelling down the mast cell degranulation, but I think of it as like a chill pill. It acts on the same receptors as CBD. There's a pile of studies with the one of the workhorse ingredients in here is PEA, about that, and just calming down children with autism, having them have more expressive language. So we know it's working neurologically. So I've been handing this stuff out because people love it when they start taking it. Like, oh my, I just feel like my brain fog's lifted, and I'm able to sleep better. There's a lot of positive things that are coming from this product. So
We should
um,
discuss that more later.
yeah, we do. We have to have a whole podcast on that one right there.
Awesome. Well, Kelly, I appreciate you joining me.
Mm-hmm.
It's one person at a time. That's how we're going to change the landscape of healthcare. And I appreciate you being here.
Yep, no problem.
All right. Thanks a million.